Hi, this is Madison Pepe, and welcome to 59 Minutes. Today, we will be discussing a disorder called dissociative identity disorder, also known as multiple personality disorders. Now, to define dissociative identity or disorder, also known as DID, it is a disorder with 2+ personalities that take over the patient's body. And it has become prevalent in the U.S. in recent years. Today, we will be working with Dr. Jessica Turner, and we will be observing the therapy session with Hannah Kennedy. Introducing Dr. Jessica Turner.
Hi, Madison. It's nice to meet you.
Hello. Okay. Does this disorder affect any other group more than another?
Well, this disorder is very spread cross-culturally. It doesn't affect any culture more than another, but it does affect women 3 to 9 times more than it does men.
Wow. Can you tell me what the diagnostic criteria is?
Well, in order to be diagnosed with dissociative identity disorder, you must have 2 or more personalities that are reoccurring, and there must be some level of inability to recall personal information due to the different identities. And the effects of these different identities must not be brought upon by substances, such as alcohol or drugs.
Oh, okay. So what causes someone to have this disorder?
Well, this disorder does correlate with childhood abuse. It does have a slightly genetic factor, such as if one parent had the disorder, such as mother or father, you're more likely to develop this disorder, but it has been shown that this disorder is mostly nurture and not nature.
Now, we will observe Dr. Turner's therapy session with long-term patient Hannah Kennedy.
Hi, Hannah. It's Dr. Turner. Do you remember
Lucy.
me?
Thank you.
Okay, Lucy. Okay. So, Lucy, have you been experiencing any inability to recall memories lately?
Well, you know, when the other personalities, when the other people are taking over my body, I don't remember what they've been doing. I have to keep a diary, and each personality writes in the diary, and then I can read back and see what's going on.
Well, that is an absolutely wonderful coping tool. I really hope that you continue to do that.
Hello.
Hello, who am I speaking to now?
I'm Charlie.
Hello,
Who are
Charlie.
you? I'm 5.
You're 5.
Yeah.
Wow.
I like tigers.
You like tigers. Me too.
Yeah.
So, Charlie, do you know where John went? I haven't seen John.
John died.
Oh.
John died when Sydney came.
Sydney. I
I
haven't
don't
seen
like
Sydney.
Sydney.
You don't? Why? Why
No.
would that be?
Sydney takes too many of my sleeping pills.
Ah.
Yeah.
Well, you need to make sure Sydney only takes the number of sleeping pills that's prescribed on the bottle, as well as the antidepressants. They only need to be taken once a day.
Okay. I'll remember. I'll tell Sydney.
Okay, you tell Sydney. Would it be possible for me to speak to Sydney?
Oh, I don't think so. Sydney doesn't come out very often.
Ah, okay. Okay. Have you been experiencing any stress or nightmares?
Hi. Oh, sometimes I have nightmares.
And any symptoms of post-traumatic stress disorder I would like to ask about. What are the nightmares about? What normally happens?
Well, you see, it's not me who has the nightmares. It's my other personalities, and I don't really remember very much of them.
Ah, okay. Well, next time we meet, I would like to try hypnosis to bring out some of the repressed memories.
Hi, I'm back again.
Hello, Charlie. Have you been having any nightmares lately?
Once I had a nightmare. It was about Mummy.
Mommy, what did she do? What happened in your nightmare?
I'd rather not talk about it.
Well,
I don't
it
like
would be
Mummy.
very, very helpful in my treating you if you could tell me what happened in your nightmares.
Well, sometimes she's mean to me.
Oh,
And
I see.
She hurts me sometimes.
Well, you are very safe now. Mommy will not hurt you anymore. Next time, let's plan on trying an hour of hypnosis to bring out some of those repressed memories. I would much like to meet Sydney next time and see if I can have a conversation with her. Thank you very much for coming in today.
Bye-bye. I like you, Doctor.
You're
nice.
I like you too.
Bye-bye.
So is Hannah similar to any other case studies you've encountered?
Well, as my years as a psychologist, Hannah has really reminded me of one girl named Sybil due to her gaining a personality. And when she gains personality, another one must die. This is shown through her therapy session when we talked about how one of the personalities had to die when the other one showed up. Therefore, Hannah is very similar to the case study of Sybil, which occurred around the 1970s.
Alright. Meet Sarah. She was abused as a child. Her second personality developed at age 7 after suffering years of mental and physical abuse. In total, Sarah has 12 personalities. Today we will be observing her first therapy session with Dr. Turner.
Hello, Sarah. I'm Dr. Turner. It's very nice to meet you.
It's very nice to meet you too.
So, I would like to go over some diagnostic criteria. After reading your chart, I see that other psychiatrists have prescribed or have diagnosed you with dissociative identity disorder. Do you remember those diagnoses?
I sure do.
Ah, okay. Who am I speaking to now?
This is Alex.
Oh, hello, Alex.
No.
Okay, Alex. Let's calm down for just a moment.
No.
I'd like to ask you a few questions.
Fine.
Okay. So, Alex, have you noticed any inability to recall recent memories, such as what you had for lunch yesterday or anything like that?
I had a donut this morning.
Was it good?
Yes.
Have you been taking any drugs or alcohol lately that could affect your disorder?
Ricky has.
Ricky? What has Ricky been taking?
She drinks a lot of bad stuff.
Oh. Well, would it be possible for me to speak to Ricky?
I don't know. She only likes certain people.
Well, I am very kind. I do promise that.
She doesn't like nice people.
Ah, okay. Well, maybe we can see Ricky next time. So, I do see that you have experienced more than 2 personalities, and from the notes from the other doctors, I see that they are reoccurring, so I do concur with their diagnosis that you do have dissociative identity disorder. Well, could you tell me about the personalities that you have experienced and how many of them there are?
Well, there are 12.
There are
is Sarah.
12.
Sorry.
Oh, hello, Sarah.
There are 12. There's Alex, who's just loud and... Sorry, here's your pencil.
Oh, thank you. It's okay. I understand.
And, Ricky is... She's trouble. She's like a party girl times 10.
Well, in order to help control Ricky, I can prescribe you some tranquilizers and some sleeping aids to help you sleep better and relax and rest. And I can also prescribe you some antidepressants to help with your moods. Would that? Yes, I believe that would be helpful. Okay. So I have noticed that Alex is a bit outgoing and aggressive.
Yeah.
But that is okay. He seems sweet in some ways. I think it would be a very, very good idea for you to keep a journal to try and, keep up with what's been going on, so that next time I see you, we can go over that together and we can assess what the next step is in your treatment. Thank you for coming in today. I really appreciate it.
What exactly is psychoanalytic therapy?
Well, this perspective mainly focuses on the subconscious and repressed memories. Sigmund Freud was a huge influence on this perspective. He was basically the person who innovated it. He contributed many of his ideas to forming this area of psychology and spent most of his life talking about the levels of consciousness and other things that have to do with this perspective. During Freud's time, my perspective was in its heyday. This was mainly in the 1930s, between World War I and World War II, around that period. Sadly, recently my perspective has lost its draw and its prevalence over time. This general approach for the psychoanalytic perspective is to draw out repressed memories and problems through hypnosis and psychotherapy.
In terms of these cases, how does this perspective apply?
I myself, being a psychoanalytic doctor, would use hypnosis to bring out all of the personalities and talk to the patient to help them deal with each personality individually. But hypnosis would help the patient, bring up those repressed memories and problems that they have been having.
Thank you for watching 59 Minutes. I'm Madison Pepe, and we will see you right back here next week.